screen. Okay, so hello. My name is Tally, and I am the supervisor of the Children's Foster Care Unit in Dakota County. And I'm going to let Jody introduce herself.
Hi, I'm Jody Blumhofer. I work as a foster care licensor strictly for relatives here in Dakota County, and have been here with the county for about 25 years in a different types of capacities. So,
And I am new to Dakota County, but not new to foster care. So I'm really glad that you could join us today. So do you want to introduce yourselves really quick and maybe just say, like, you are obviously a relative foster parent, and maybe just talk about who you have in, not the name or anything, but just who was in placement with you.
Okay. I can go first. My name is Janet Johnson, and I am in the process of being licensed. I have my good friend's grandson. He has been living here since May 17th, I think. And his grandmother and his younger siblings are also here in my home. And the oldest grandson is 17, and he will be finishing his senior year at Shakopee High School.
Okay.
So, and I offered to my friend that he could live here to finish out his last year. Now, my friend, she lives in Fairfield, Illinois, and she is going to take his 3 younger siblings back with her on Saturday, back down to Fairfield, Illinois. And she will be the temporary foster. She has to go through the foster, become a licensed foster home for her grandkids down there. So kind of a unique, very unique situation. Yes. I keep hearing that. Oh, this is such a unique situation.
There's always lots of unique situations, believe me. So yeah, thank you for doing this.
Yeah.
Okay.
I can try to do this without her crying. My name is Ayan. I have my niece with me for now, and then if nothing changes in the 6 months, she will be adopted by me. So
okay.
Wow.
Yeah.
Wow.
Great. Well, thank you for both of you. So we're just going to get right into this and start looking at what we have here. So these are the introductions. So we already talked about we have 4 relative licensors here in Dakota County, and 2 people do traditional licenses. So you both are in the relative licensors, and relatives, it's a little different. They get the children first, and then you get licensed typically. Now, like I said, there's always unique situations, but typically for relatives, the kids come to you, all of a sudden you get a call or something and said, hey, we have some your nieces needs a place to go. Will you be their foster parent? And then you get licensed. Traditional foster parents, they need to get licensed first, and then they get the children. They're not related to the child. So that's the difference. Relatives or kin, they're related to the child or have some kind of relationship, where traditional homes, the children don't know anybody in the family or in that home. There's nowhere else for them to go. So they're going to go to a traditional provider. In Dakota County and most all over the country, the best place that we find that the placements work out the best is with somebody they know. So relatives, is the way we try to do it on all the time. It doesn't always work that way, but probably about 75% of our homes are with children are with relatives, while 25% are in traditional homes. And then this is just the main number that we have that goes to our main. It's answered Monday through Friday, 8 to 4:30. So that's just that number. What is foster care? So foster care is a temporary home.
Showing us the PowerPoint?
Can you see it?
Oh, right
No.
now we're just seeing you. I wasn't sure.
Yeah.
Oh, I'm so sorry. Okay. Can you see the PowerPoint now?
Yep.
Yeah.
I am so sorry. Okay. I'm looking at the PowerPoint just fine. So, okay. I'll just go back really quick so you can kind of see this. These are the 4 licensors, like I was mentioning. We have 2 traditional and then our main number. So moving on to what is foster care. So foster care provides temporary homes for children whose parents or guardians are not able to take care of them, and it's come to the attention of the welfare agency staff. Our goal is to keep children safe while supporting families' efforts to reunite. Now, so foster care, our whole goal of foster care is for children to reunite with their parents, but sometimes that's just not possible. So as a placing worker is kind of working with trying to help the parents, reunite the families back together, but they also have to work on permanency all at the same time. Now, Janet, yours is a little bit different because the child is 18, or 17, so they're a little older.
Yeah.
So there's there's always rules and different things to foster care, but basically it's just providing a temporary home for children while their parents are working on themselves and hopefully that they can go back with their parents. This just talks about foster care is a state administered through Dakota County. So Dakota County license your homes. We can only license homes in Dakota County. And then we send it to DHS through the state, and then they send you the license. The licensing process takes about 4 to 6 months, depending on how fast you want to go. Relatives I already talked a little bit about relatives having children placed before being licensed. But the law and how you get licensed is the same for both relative and non-relative providers. So you both do basically the same things. Any questions so far? I'm going to let Jody jump in now.
So obviously, as Tally was saying, there's always rules and laws that govern everything that we do in the child welfare system. And in Minnesota, we go under child foster care licensing goes under the Minnesota statute 245A, which you should have copies of this if you don't already will when your worker comes out. But that is the Human Services Licensing Act for child foster care, adult foster care, and daycare. It's through the Division of Licensing, and that's at the state level. The whole point is to enforce standards adopted to protect both the health, safety, rights, and the well-being of children and vulnerable adults that are in programs required to be licensed. That's not the only rule we go under. We also have Minnesota Statute 245C, which is the Human Service Background Studies, which you may have been hearing the words Adam Walsh study or fingerprints and photos. That's that process. We are also governed under the Minnesota Rule 2960.30 for licensures and certification of certain programs for children. Obviously, then, as we go down from there, there's city and county ordinances that may or may not apply depending on where you live. Building safety codes and zoning also kind of guide how we do our jobs. Fire code and inspections. In some situations, we have to do fire marshal come in or something. Then, of course, there's also agency policies here in Dakota County. And it's up to us meaning the licensing workers, to visit with our families, our foster families on a regular basis. And if that doesn't mean you have to wait for us to come out to talk with you. I mean, if you have a question or concern, you should be able to get a hold of us either through that generic number that was on the first slide, or or hopefully you'll have your licenser's number directly or emails. So that's a whole lot of information, and there's even more information within each one of those statutes, but that's kind of the overview at this point. So foster care licensing is a Minnesota state license that is administered through Dakota County. So technically we are just agents of the state in a very real way. By law, licensing requirements for child foster care are the same for relatives as they are for non-relative foster providers. The only major difference, and Tally, you can correct me if I'm wrong, is the amount of training in the very, very beginning. It's the non-relative, or what we call traditional foster care homes, usually go through a lot more training before a child is placed with them. But because we do feel so strongly that children should be placed with relatives and or kin as quickly as possible, that's why we kind of have skipped that piece for relatives. All foster care rules are from the state, federal, and state and federal statutes. So anything that we're doing, it's not because we just feel like it. It's not because we're just trying to throw this in. It's because, it's actually written down in law. It is important to follow the rules of foster care. And not following the rules of foster care could lead to consequences such as something called a correction order, fines, and it actually could put your license at risk of being revoked, which we do not want for anyone involved. Then, let's see. So the licensing process and timelines, as mentioned earlier, it's usually about a 4 to 6 month process, and it really kind of is dictated by how quickly, well, to some degree, how many cases any given worker has, but also on a very real level, how quickly paperwork can get back to us. So the initial step is that obviously a child is going to be placed in your home. Chances are by a child protection worker or maybe a children's mental health worker or something to that effect. Then that starts the ball rolling because they do some very preliminary paperwork with you, which is an application, maybe a background check, something called an individual fact sheet. You may or may not have heard of these things, but usually you might have heard of some of it. Eventually that paperwork gets to a licensor, such as myself, for relatives. And we then move forward with conducting background studies. Even though the original person who came into your home likely did a walkthrough, a licensor is going to do another home safety checklist walkthrough because we have an eye towards things that might be missed by an ongoing worker. We'll then talk to you about the different trainings that will be expected for you to attend. Most of those are through online. However, there's at least one that is not online that you have to go to depending on the age of the children that you are caring for. We are also going to want to talk to yourself, the other co-applicant, if there is one, and any children ages 7 and older, and it's not going to be a real deep interview, obviously, with a 7-year-old, but it's going to just be kind of touch and base and having some questions answered. It's not uncommon also to, talk to adult children that may be in the area or that we could speak with just to get, more information and explain why having the EU license as a foster parent is a good idea. And finally, the goal is to complete licensing requirements. And again, 120 days, that's a little tough sometimes, but usually at least within 6 months, we try and make that happen. So let's kind of talk about, did I
go back?
No, and then we got it now. Yep. Okay, so let's talk a little bit about the background studies. So these are done through a fingerprint process, and we have photos taken. And all the information is run through an FBI database, so that we know that all homes that we are licensing are safe. So every applicant and adult household member, 18 and older, must do a fingerprint study background. That is, there's no way around that. Children who are 13 years and older must do a non-fingerprint background study. They must also do a fingerprints if they have lived out of the state of Minnesota within the past 5 years. So the difference between these two things is with obviously the fingerprinting, you actually go to a kiosk, they scan your prints, that's run through the FBI check. For children over the age of 13, but under the age of 18, they have to do, we just have to get their information, make sure we take their name, run them through our generalized system, not the fingerprint system. Again, the only exception is if a child between the ages of 13 and 17 had lived out of the state of Minnesota within the past 5 years. Did you have a question, Janet?
Oh, no, I was reading it and I'm like, every applicant and adult household member, and I'm like, oh, that's just me. I thought the 17-year-old who's living in my home had to have the fingerprint also.
No.
But no.
As long as that 17-year-old has not lived outside of the state of Minnesota in the past 5 years, he does not need a fingerprint.
Okay, got it.
One of the things that, I try to stress when I'm working with my families is not all offenses are disqualifications, meaning you would not be allowed disqualifications, meaning you would not be allowed to be a foster home. And we usually refer to those as DQs. However, some things that may be in your background or history could be a DQ and might prevent a person from being licensed, while other things might only need to be reviewed. So some crimes, it's going to be an absolute no-go. If somebody has a first-degree murder conviction, chances are you are not. That's a no-go. On the other hand, there are other things such as maybe a history of, I'm just gonna pick something like the disorderly conduct, and we're just going to have a conversation with you about that. But one of the things to remember, regardless of what types of history you have in your criminal checks, there's still a due process that can be followed. So people can request what's called a reconsideration. So if there is something that prevents you from being licensed or is problematic, there is a process to follow that we can request the Department of Human Services to do a variance or something called a set aside. But it's worth going through that process. I think I will at this point hand it back to you, Callie.
All right. So foster care training requirements. I'm sure when you said, Janet, oh, I'm going to watch my friend's grandson, you weren't thinking that you were going to have to do training and background studies and it's like, what did I get myself into here?
Yep, that's how I'm feeling.
And I know sometimes it can be overwhelming again for relatives and foster parents providers, because like I said, you weren't really expecting this. You're doing something out of the kindness of your heart. You want to take care of somebody that it's a relative. I can speak for myself. I did this myself. I was a foster care provider for a nephew of mine, and we ended up adopting him, but I had two of my own kids. He was the third, but I had 2 kids. I was working full time. I did not realize that I had to do all this stuff too. And I'm like, I'm his aunt. Why do I need to do all this stuff? But believe me, like Jody said earlier, this is all requirements that are in statute or laws. So basically, and talk a little bit about the training here. Everybody has to take children's mental health 1 hour every single year that you're a licensed provider. So everybody has to do that. There's also a yearly mandated reporter maltreatment of minors training. So that's due, you have to take that every year. Again, this is online. There's a child passenger restraint training for every 5 years. You need to take that. And that's if you're caring for a child under the age of 8. Sudden infant death, abusive head trauma every 5 years if you're caring for a child under 6. Everybody has to take one time. It's called normalcy and reasonable prudent parenting. There's also a training called quality parenting initiative training. That's like an hour that needs to be only taken once. Fetal alcohol training needs to be taken every year. And then once you're licensed, not before, but once you're licensed, everybody has to take 12 hours of training every year. So once you get licensed, you still have to take training to keep your license every year, 12 hours. And we provide you with resources and training on that. So these are just some of the trainings. Once you get licensed, there's all different kinds of trainings that you can take. Foster care home requirements. So what does your home need to have? A child must have a bed suitable for the child. Children should not sleep in unfinished basements, attics, or hallways. The bedroom must have 2 exits. And when licensors go through, they need to check like your windows. Does the window go up and down? So the foster, in case there was an emergency, could the foster child get out? You also can't have stuff in front of a window in case a fire department needs to come in or a child needs to get out. So we couldn't have things blocking windows. A child must have room for, whoops. I just touched this. Okay. A child must have space for their clothing and personal items. A dining room table must accommodate all household members. And if you rent part of your home, a background check would needed to be completed on occupants. That means like if you had a roommate or something like that. Does anybody have questions about your home requirements or the requirements of training?
No.
Nope. Okay. So understanding the custody of children in care. So just so you know, the foster, this can be kind of confusing to some foster parents. One thing you should never do is sign off on any approval for medical procedures. So you might think like, oh, I'm the foster parent, I'm just going to sign off on this. He's going to have surgery. Now, if it's an emergency, yes, things like that, we know, but you should always make sure you talk, if you have a good relationship with the parent or the placing worker would make these decisions when this kind of stuff happens, because physical custody, the child is in your care. So you have physical custody of the child. Legal custody, Dakota County typically, or whatever agency they have custody of the child. They have legal custody. Parental rights, sometimes parents retain some of their rights in many cases. Sometimes rights are terminated when they're foster parents. So again, the person who has legal custody is the agency. So foster parents' do's and don'ts, again, don't sign approval on medical procedures. Do get written permission before you take a child out of state. That even means Wisconsin. So even if you go to Wisconsin, you need to make sure that the placing worker knows that you're going out of state. Now, Janet, I think yours is coming from Scott County. So Scott County would be the legal agency, and the worker over there, if the child were to go, out of state, you would need permission. And sometimes it's actually a court order, depending on the county that you're in. So they could need a court order to even go to Wisconsin. Don't sign any IEPs or educational plans, again, because you technically don't have custody of that child. So these are just kind of little things. I know one thing foster parents sometimes do too is they want to cut the child's hair. And that's kind of a touchy subject for some families. Like some people don't want their child's hair cut. So again, I would, even before you cut a child's hair, I would, if you have a good relationship with the parent, or if the placing worker could ask the parent before you cut a child's hair, sometimes that makes a big difference for people. Or piercing earrings, for example, you shouldn't get a child's ears pierced. All these types of little things like that.
I just want to hop in real quick here, Tally, if I
Yes,
could too, because
yes.
we're talking about do's and don'ts. Another area that many people might think would be routine, not a big deal, don't need anybody else's signature, would be immunizations. And obviously, for a number of reasons, that tends to be kind of a touchy subject, and we do not want, unless you've heard specifically from the worker that immunizations are okay. Some parents do not want it. So, just be very cautious and thoughtful about taking a child in and getting immunized.
Yep, that's a good example. Thank you. So examples, foster parents can make decisions, day-to-day decisions about appointments, registering for sports or extracurricular activities. That's fine. The agency would decide where the child will live, signing IEPs and other school documents. Authorizing out-of-state travel, authorizing major medical procedures, and the parent would make choices about the school, cutting hair, piercing ears, immunizations, that kind of thing. Any questions about that? No. Okay.
Nope.
Okay. So is this mine still, Jody, or is it?
I
Jean?
believe so.
This is
jumped in
me.
after
Okay.
Jean. Yeah.
Okay. So what does a foster parent do, and what are their roles and responsibilities? So now, instead of being the aunt, you're kind of the parent, so, or sometimes they were the grandma and now they're the parent. So your role sometimes changes as a relative foster parent. But what we ask is that you would provide children with a safe and healthy family life that promotes child development. You would provide supervision in accordance with the child's needs, age, and the placement plan. You would actively cooperate with the child's case manager or the placing worker that brought the child to you, the licensor, and other professionals. So you'll get to learn that sometimes there's going to be a guardian ad litem involved in the case. There's a placing worker, there's social workers, there's all kinds of new people, a therapist. There's lots of new people in your life and this child's life. And you would have to work with all of them. Excuse me, respect the importance of the child's birth family to the child. So sometimes it might be your sister and maybe she's not doing the right thing, but it's really hard for the child if you're talking bad about their parents. So really remember to respect the child's birth parents in these situations like this. Facilitate parent visits and sibling visits to the degree as possible, and extended family visits. So some foster parents are getting kids to visits, having visits with siblings, and that kind of thing. Keep information about the child and their family confidential. So that's one of the things that foster parents don't realize, that even though it's a relative of yours, that you are responsible to keep that information confidential, or the reasons why the child is in your care. And we'll talk a little bit more about confidentiality coming up here in another slide. So I'm not going to get into that, but the important thing is to really this is private information and it's not to be shared with your friends and other people. Act as a mandated reporter. So that means if you see abuse, that you need to report it as a mandated reporter. And that's why everyone has to go through the mandated reporting training every year, and you'll learn more about what that is in that training. Maintain an open, ongoing communication with placing worker and licensors. So let your placing worker or licensor know what's going on. If you need help, if you need assistance, keep in touch with them if you move, just little things like that, that it's really important to make sure that you're keeping in touch and maintaining that open communication. And then we just ask if you could, work with your licensor to get all your paperwork done and your background studies done within the 120 days. Any questions about, what your role would be?
Well,
Okay. Well, here
So,
it is.
I was
Maintain
gonna say,
confidentiality.
yeah, this is one of the most important things that we rely on our foster parents for, both traditional and non and relative, excuse me, is that, they are protective of the child, of their situation, and the information surrounding them. So one of the things that at least I personally have seen be really kind of an issue is online sharing of information. And when I say that, a simple picture could be well, not could be, is information. So maybe you were the aunt or the uncle or the grandma or the grandpa or the really great best friend, and you used to be able to share all these photos of the same exact child during that time, that you were just not taking care of them, but now you are an official entity as a foster parent. And so foster parents should not post pictures of their foster children on social media, even if that child is your relative, and even if that's been allowed in the past because, you were grandma back then, or as I had already explained. But that's just, you really can't do that. That can be difficult, though. Sometimes I know I've seen many times people make that error. The next thing is that foster parents should be sensitive to private information, and this information should not be shared. So anything that you might learn through the child protection case, or, I mean, it might come to you through the county, and chances are you wouldn't have learned it through any other avenues yet. That it can, it makes life much more difficult, and people can get into a lot of trouble if they think, well, I'm just going to tell, my other sister or my brother, or you just can't do that. The final thing is that foster parents have a legal obligation to protect this information on behalf of the child, and breaking that trust or giving out that information, it can have very serious consequences for everyone involved. And, I mean, it's such an important thing that the information is guarded, on behalf of the children, because it's not gossip, it's their lives. And as best we can, meaning we, the system, and those helping us, foster parents, we need to be mindful of that, and try and keep it from getting out further than it needs to. So, oh, hang on. Yeah, the next slide then would be, what are you maybe going to be kind of having to deal with any particular foster child, or of any age? And it can be a number of things that may or may not be age appropriate, such as bedwetting. You may have a child that comes into your home and has poor hygiene. They may have short attention spans. Hoarding food can be quite unexpected. And some of these are, like I said, normal for certain ages, but sometimes it's not. A child might come into your home and have the mouth of a sailor and swear a lot. They could have pretty poor social skills. They might lie about things that make no sense to lie about. They might have confrontational language, seem to always want to have an argument over everything. They could be aggressive. Some may have, mental health concerns that are easily addressed, but, some may have very significant and serious mental health concerns that need much more help. We see difficulty sleeping. Oftentimes with small children, we see issues with prenatal exposure and withdrawal. And that can make, I see you nodding your head, that can make for very long nights and days, and pretty difficult situations. Foster kids will probably have difficulty expressing their feelings or emotions. sometimes what happens is, they have, in some way, shape, or form, information has gotten out from about their families, and they will want to clam up because, boy, that, kind of like, well, that escalated in the sense in their minds, well, now I'm not with my family. Maybe I shouldn't be sharing anything about anything anymore, which that, as I just explained, kind of bleeds into the idea of difficulty trusting other people. And it's not uncommon to see kids stealing things. One thing I try to tell, like most of my foster parents, is the behaviors that you see a child who has come out of a chaotic home, those oftentimes may have been behaviors that help them to survive the chaos. And they don't just forget those. That helped them survive. So they're still in that type of survival mode. And so they might still come with hoarding food or bedwetting or stealing, all of those things. Maybe because they hoarded food before, they were able to eat, or, maybe when they stole before, they were able to go, buy something that they needed to buy but as best as we can, try to put it in the understanding of they're needing to relearn and give them that time and grace to do that. It's not going to be easy, but it's they're needing that help and time.
Yeah, and I just wanted to say, I know we put a whole bunch of, it sounds like it's a lot of negative behaviors on here, and not all children are going to fall into these categories, of course. But I don't know if you can imagine being taken away from your parents for whatever reason it is, and you're with somebody else now, and they're going through trauma, or they've experienced trauma in their life. And it's really hard to, as a child who maybe can't articulate what they're trying to, what they're going through. So sometimes they act out in different ways. So again, when making this, we certainly don't want it to be like everybody's going to have all these horrible things, but we do want to be honest, and just so you're aware of what could happen or what you could see. But also, I think Jody really put it eloquently. These kids have gone through a whole lot to get to where they're at. I mean, something happened in their family that they experienced where that's why they're in child protection. Usually it's nothing that they did, but it's something that their family, happened in their family for them to get into foster care. So I just wanted to add that. But
so, the next slide talks about, when faced with some of these issues and other needs as a child, what do foster parents do as a whole? And the number one thing is we really hope and, that we can all see the good in the child and help it to continue to shine on, to encourage the positives, and as much as we can, kind of gently steer kids away from those negative things that I was just explaining. We want foster parents to obviously take care of the daily needs, do their best to allow a child to be a child. It's not at all uncommon to see kiddos come into our system and they are parentified, or they don't know how to stop being an older kid when they might be 8. So just encouraging a kid to enjoy kid things. We really expect foster parents to help out with transportation, whether that be to doctor's appointments or if at all possible to visits and so on and so forth. We want you to be an active member of the child's, care team, of the child welfare team. We're interested in what you have to say and what because you are living day in and day out with these kiddos. So your input, although won't be able to be the final say, it is important to have to make good decisions on behalf of the children. We want you to help the children grow, and by doing that through providing nurturance and guidance, keeping close communication with the school to see how things are going, and when necessary, be that advocate for the child, be their voice when they can't speak on their own, provide emotional support, and making sure that you keep the child safe, but also let the child themselves know that they are safe. If it's possible, this can be a little tricky, but being a mentor to the birth family, in some situations, it's just not going to work. And that's not because of anything that the foster parent did or the child did, or, it's just not going to work. But when there is an opportunity, we'd really like to see that relationship between a foster parent and the birth parent, to work together, on behalf of the child. We also expect, obviously, that the child will be provided clothing, that you guys would ensure that the medical needs of the children are met, and attend to any of the child's educational needs, or that would be similar to going to conferences, or getting them school supplies, and so on and so forth. Does anybody have any questions on that?
So a foster parent would go, they can attend the foster or the child's school conferences and stuff like that.
Yes, we
Oh.
would want you to be part of that, because
Oh, okay.
you're the hands-on, day in and day out person. So
Yeah.
you're the one who's going to, if you hear that Johnny is acing math, then you won't have to bother Johnny about math. But if Johnny is not, then you might need to get on him for that. And I would, sometimes parents go to those as well. Hopefully, if you're in that situation where you guys can sit down together, that would be great. But I know most schools, not all, I'm not going to pretend it's all, would probably make time for both the parent and the foster parent. I know that happens in situations where it might be a divorced family and the parents don't get along. So I would think that could still happen.
Okay.
Let's see here. So the next slide, when to notify your licensing worker. These are just some of the main times that we would hope that you could, you need to give us a call and let us know what's happening. You may receive, even though you're doing relative placements, you may receive a placement of another child. I've had many cases where there might be a 2-year-old placed, maybe mom is pregnant and another child is born, and that child is going right into placement too. I don't always get a heads up on that from the placing worker. So give your licensing worker a call and say, hey, listen, Johnny's little sister Susie just was placed here. Before placement ends, if you know that the child might be going home soon, you can give us a call and just say, hey, this is what's happening. I don't think my license, you may or may not want to keep your license, but just let us know. Or before a child moves into your home, if you can, a change of households members, and that includes pets. So if you guys happen to, you might have somebody move in as a roommate, or a college student who comes home, or, something to that effect for the summer, or if you get another puppy or another kitten or something to that effect. Yeah. So all of those would be considered things that you would need to let us know about. Changes in your address or telephone number, or any major life changes that is happening. So a good example of a major life change that I know is currently happening in one of my cases is that the parents are getting a divorce. So they just let me know. It doesn't really impact the situation at all. It doesn't, it's not and so it's just something that I will keep track of and note and update. But it's important that we know who is in and out of the home. Prior to any out-of-state travel with the foster child, we would want to know that was happening. So it doesn't have to be a real long thing, other than just an email. Thinking of this same family, an email saying, hey, we're going out to New Hampshire for a couple weeks, and then in the end of July, we're going to Texas for a couple weeks. I mean, that's it. It's really just an email. Anytime the child has an emergency, such as going to the ER, or the school is calling because of a major incident or a serious illness, we need to be given a heads up on those things. And if you yourself have any type of a medical emergency where maybe you are not going to be able to be as hands-on or maybe not hands-on at all. If you're going to be, out of the home, we need to be aware of that, even though, you might have a co-applicant or something, and that's great, but we still need to have a heads up. And if at all possible, the agency requires a 45-day notice when you wish for a child to be removed from your home. So if it's not going well, it's nice to have that 45-day just because that we can work on it at a slow pace. We understand that's not always possible, but if you can make it happen, it really works better for ourselves and the kids.
I know we don't really have a slide in here that talks about respite, but let's say you just need a break for a reason. As a foster parent, you could reach out to the placing worker or your licensor and just say, we do have foster care homes that would take a child like for a weekend. Let's say you just need a break, or maybe you're going out of town, you need to go out of town and you can't just leave the child alone, even if he's 17, that kind of thing. We do have respite. It's called a respite foster care home that would give you a break, or if we're going on vacation, that kind of thing. So we do want to make sure that you're aware of there are resources out there. We have support groups for our foster families. Foster Together is an amazing program. So if you have not checked out Foster Together, they also have a lot of resources for foster parents. But we want you to know that you're not in this alone, that we will work with you and we'll be there with you through all these things, because it's not always easy being a foster parent. You just think like, oh, I can handle this, it's no big deal. But sometimes there are things that it can be difficult sometimes, and there are challenges. And we just want you to know that you're not alone, that there are a lot of supports out there for foster parents. So if you're ever interested in being part of our support group, we have one once a month. If you wanted to be part of Foster Together, they have all kinds of coffee breaks and trainings and all different kinds of things. So there are things out there. We don't want you to ever feel alone.
And we don't look negatively either. I mean, if you come and say, well, we need help with this, and we do have other supports, such as even like therapy stuff, and I won't go too much into detail on that, but to help support our foster parents. It's not, I mean, you guys looking for support and seeking out those resources is not a negative thing at all. We actually would rather have that than not. So.
Yep.
Okay, so then we get to teamwork. So there are a lot of people involved when you are doing foster care. You're going to have the birth parents, obviously, or whoever happened to have been the guardian before, if they're not birth parents, or then you yourselves as foster parents are part of this team. The licensor, that's going to be helping you guys to learn the I would say baptism by fire, where you're learning very quickly how to do foster care, and you don't have a lot of the training that other non-traditional that other traditional homes have. Guardian ad litems will be involved, which they are court appointed, and from the court to give the court just a very obvious information strictly about the child, how the child themselves are doing. And then also the placing social worker, the child protection worker is going to be involved, and together, all these different pieces and parts kind of help to make this system work. And the information that you provide will be very helpful for a myriad of reasons, but I think most importantly is that you're seeing this child day in and day out. You're the primary caregivers. So your input is really important.
The other thing I don't think we have, oh, sorry.
No,
Yeah.
go ahead.
The other thing I wanted to say too is that the placing worker has to do a case plan for the child. So you should all, as a foster parent and being part of this team that we're talking about, the placing worker will make this case plan, and the role of the foster parent will be on there. So if you don't have a copy of that case plan, you should ask your placing worker to get that I just encourage all foster parents to ask that because the case plan has what the expectations are for you as part of this team. Sometimes I mean, I hate to say, I don't think that they always get the case plans to the foster parents, but it's really important so you know what the birth parent needs to work on, what you're supposed to be doing, and it's all really clear. The other thing I wanted to say is that the licensor, so like Jody or myself, we're really your support system. We're here to support the licensing process, making sure your house follows all the guidelines and all the rules that we talked about earlier. But we're also here to support you in what you need, where, the placing worker is looking maybe at the child and the parents, and sometimes foster parents too, but we're really the main person there to really support you in the licensing area. So I want to make sure you know that. Any questions about this? Because it is kind of confusing, because there are lots of players involved. And we just want to make sure that you have all the resources and knowledge that you have that you can get.
I think I might add one real quick thing here too.
Yes.
When you are a foster parent, if other than the birth parent, I think, yeah, pretty much if a licensor comes or guardian ad litem comes or child protection worker, you really do have to allow them access to the home and the child. It's a little, it can feel a little unnerving, I think sometimes, but it's we do have the right to come into the home at any time to make sure that things are going okay. You are technically a facility, even though you may not see yourself as that, for obvious reasons. But yeah, just remember that we technically, if there happens to be a complaint, we can come in and just double check things to make sure things are fine. So.
Yeah, good point.
All right. So then the payments, I always kind of chuckle at this because, I talk with families who never ever thought they'd be a foster parent and then find themselves being a foster parent. And we discuss the fact that, so many misconceptions about reimbursement and the amount, and it never really does cover everything that you need. But the payment that you get for foster care comes from the county that placed the child in your care. So in that sense, a lot of times we get a child that comes out of Hennepin County because their auntie happens to live in Dakota County or their grandma lives in Dakota County and the child had lived in Ramsey County. In those situations, you will be receiving your payment from Hennepin County, even though you're a foster parent for Dakota County, technically. Hennepin County is where the payment will come from for the child. Each county does have its own payment system and rules. And so I can think of one case right now where I had 2 kids out of Olmsted County and 1 kid came out of county up north. And so, they were kind of having to deal with 2 systems and they were different. I mean, some of the basics are the same, but the paperwork might be a little different. So the things that you should be aware of, one of the most important ones is the MAPC assessment. That is supposed to be done with the foster parents' input. The reason why I bring this up is it's not uncommon for me to hear from different foster parents that they don't even know what a MAPC is. They never heard of a MAPC. And forgive me because I cannot remember right now. Maybe you can tally what MAPC stands for, but we've been calling it MAPC for so long. I just don't remember what the acronym is. But in essence, it talks about what is the child's need. Then it goes into what is the foster parent doing to meet that need. And these things all come together, whether it's, medical needs, educational needs, or, psychological help. All of these things kind of come together, and that's how they come up with an amount for foster care reimbursement. Because a foster parent who's having to drive 2-3 times a week to get a child to maybe group therapy, individual therapy, or that's a whole lot more work than a foster parent who doesn't have a child that needs those things. So that's how we try to figure out how to fairly reimburse everyone. So that's why it is important that you're a part of that. The next is the monthly payment invoices. So at the end of the month is when you send in an invoice which says this child was here from the 1st until the 30th. And, depending on the county and how it works, how their invoices work, you send it in and then you get a payment. Now, I always make a point to tell my foster parents two really important things. Number one is this is not considered income and for taxable reasons. It's considered reimbursement. That's why you're getting it at the end of the month and at the beginning, not the beginning. The idea is that you've already spent the money and so they're giving it back to you. The other thing I always say is chances are it's not going to cover everything. It just doesn't. That's just kind of the truth of it all. But hopefully it'll get you a significant way. There are some things out there that can help. There are childcare grants and to help with daycare sometimes. And you might want to talk to your worker about what's there as an option for you and your specific situation. There's also Head Start, working with the school to see what and if a child will qualify for early intervention services. The county is going to be helping to make sure that the child's healthcare needs are covered, and all children who go into foster care are covered under medical assistance in some way, shape, or form. That's not always a real quick process. It usually gets done within the first month, but it can be kind of a issue those first few weeks. And one of the other last things that is important to know about is what's called the clothing allowances. And sometimes children come into care, in particular, as I'm watching the babe over there, they come in with little or no clothing. In those cases, we can authorize a clothing allowance. Again, that's something that you should probably take up with your ongoing worker, the placing worker. If you're feeling like you can't, or you feel like you're not getting anywhere, you can absolutely bring it up with the licensing worker and we can help you kind of stumble through that. But the clothing allowance can be, really helpful, especially in the beginning of a case. Usually, the ongoing after 6 months to a year, the idea is that the foster payment should be covering the clothing ongoing. But in the beginning, yeah, sometimes you have very little to nothing, and it can be very difficult to put out that money in the beginning.
Right. And I just wanted to just say a couple things too. It's really hard to talk about payments because in Dakota County, we work with so many other counties, and every county is like Jody said, every county is a little bit different. Same with clothing allowance. We can speak with Dakota County, but it's really hard. I don't know what, Scott County does or other counties. So I know we're kind of giving you a general overview with this, but we don't want you to go to Hennepin County and say, well, we took the Dakota County training and they said you're going to give us a clothing allowance. So it really depends on where counties are and what they do in that county. But I'm saying generally people can get clothing allowances. And I also wanted to point out that Head Start, all foster care kids, I think it's even birth to babies to, pre-K, qualify and go to the head of the line for Head Start. So it's a great way to get kids in Head Start programs, because if they're in foster care, they go to the top of the list. And then the other thing with the healthcare that I wanted to mention is make sure you get the child's MA card, or every child, like Jody said, in foster care will have a MA card. That card would come from the placing worker again. But you should always make sure you try to get that card. Never pay for any medical expenses for a foster care child, because it should all be covered with their medical assistance. And once you pay for it, I've had foster parents pay for things, and it's super hard to get reimbursed. If you will get reimbursed, I don't want to. It's just really hard. So I would strongly encourage you to not pay for it, or if you do pay for it, I don't know if you'll get paid or not, reimbursed for that, but just wanted to let you know that. Any questions about payments? This is kind of a touchy thing, just only because like I said, it's different in every county.
Well, I have a question.
Sure.
Once you get licensed, will I be reimbursed for, expenses, that I have already paid for, while I have had, the child in my home?
The payments will start the day the child came into your home. So if you haven't been paid yet,
Oh,
it should start you should get an invoice at the end of the month for the child to get paid,
oh,
for you to get
oh,
paid.
It
Okay.
can be, it can in the very beginning be a little delayed, because
mhm.
whatever county you're working with has to, give you a provider number. And I know in Dakota County for a while, it was like taking 2 months. And I don't think that's the case anymore, but it was taking a while. But yeah, if you're like closing in on month 2 and you haven't seen anything, even if it is a out of county situation where your child was placed from a different county, I would strongly recommend calling your licensing worker and saying, hey, is this normal? And, we can help you kind of navigate that, and figure out what to do next. Cause yeah, it's important.
Yep.
Okay.
I always say it costs money to raise children. Doesn't matter if you brought them into this world or not. It
Yeah.
costs money.
It does. Exactly. Thank you.
Okay.
So self-care, we just want to know that all parents really should take, making sure that you are taking self-care while you're doing this job. It's not just always an easy job. So making sure that you take care of yourself so you can take care of others, take breaks, use respite like I talked about a little bit earlier, or if you have a substitute care person, don't be afraid to ask for help or suggestions. Know your limitations and areas for skill development. Don't be afraid to ask. That's what we're here to help support you. So we want to make sure that you are supported and are getting the care that you need, because it can be it's different, and it can take a toll on you. We talked about we did talk a little bit. I didn't know this was in here, and I already brought up respite a little bit, but respite, again, that's where the child would go to another licensed home. You do not get paid if the child goes into respite, so you only get paid for when the child stays overnight in your home. So for example, if the child left your house on Wednesday, you wouldn't add that on your invoice. The only time you can add a child in the invoice is if the child stayed in your home at night. So you don't get paid for when the child is not in your home, even though they may have been in your home until 5 o'clock that night. You still can't bill for that day, if that makes sense. So just so you know, if the child does go into respite, or if when the child does leave your home, you don't get paid for like that last day unless they stayed overnight but does that make sense how that works? So I'm just making sure that you fill out your form correctly. If you do have a substitute care, and you should have some kind of substitute care person, just in case something comes up, or like at least have an idea. If a substitute care person, and we'll get into this more technical, but if a substitute care is basically somebody who would care for your child more than 72 consecutive hours at the same time in your home, and they would need some additional training and a background study if they did something like that. And then a babysitter, no specialized training required, but a babysitter would be somebody who occasionally would watch your child. They should be somebody responsible, because I just like to make sure that people know this, if anything were to happen in your home with a babysitter or even a substitute care person, that comes back on your license, even though maybe you weren't in the home, you didn't do it. But those are things that could come back and look negatively on your license. So I want to make sure people really understand that. And no, there are different care options available for you, but just making sure that you pick a responsible babysitter, some, you know, we don't really put an age to that. I mean, I think it has to be somebody over, I don't know, do you remember the age? Is it 14 or? I can't remember
think
the
it was
exact
14.
age, but some 14-year-olds aren't responsible enough. So they shouldn't be watching a child. And the child maybe in your care may have a lot of high needs. So it might be somebody who needs a little bit extra training. So it just really depends on the child and the babysitter and what the requirements are. Because I know it says like no specialized training required, but you really need to make sure that whoever is doing the care in your home or oops, sorry, or the babysitter does have that training and is mature enough to handle the child that you have. So how can we help? We try to place kids with qualifying relatives to maintain those placements whenever possible. We want to make sure that we are making sure you get the supports that you need. We try to match when relative placement is not possible. We match families to children based on the children's needs, culture, and preference. Our goal is to work with foster families to support them in getting licensed and keeping children in placements with nurturing, caring support of families. Licensors provide necessary resources for foster families. We offer training opportunities to help foster parents grow and learn. And like I said earlier, we are your worker. We're there to kind of support you. So one of the few last common questions that we have from foster parents. So one, I'll start off, Jody, but can a foster parent have a pet? Yes, foster parents can have pets, but they need to be vaccinated. Now, some pets like turtles, amphibian, those kind of reptiles, they say that it's not okay, or we would have to do a variance if you have a child 7 and under for reptiles. Do you know why that would be? Salmonella. So
Oh.
children under that age, we can write a variance with a safety plan in place, but those are some of the exceptions. If they have a pet or reptile for children under, I think it's 7. Do you want to do the next one?
Yeah. Do children stay in their own school or switch schools? Either one of these can happen. We really would rather they be able to stay in their own school. In fact, I have seen situations where the county is saying they have to remain in the same school. They have to go back and forth to the school. It kind of depends on your worker and the county that has placed a child there. And again, it's can be a difficult kind of situation. I've seen situations where certain workers would expect the foster parent to drive them back and forth, and that can be difficult. And so if you are one of those people that has a situation where it is being asked of you and it's a difficult thing, definitely come talk to your worker and we can try to figure this out together, because it's not always the easiest thing to just go drop a child off at someplace up in St. Paul in the morning and pick them up. So, but yeah, just let us know and we can help you navigate that one.
So this is a good one. How long is my license good for? So typically license for relatives are good for 2 years, but every year you have to do something. So even though you might have your license might say it's good for 2 years, every single year you're licensed, you have to do the 12 hours of training. You have to fill out more paperwork. So there's always something every year that you're going to need to do. So when next year, your licensor says, oh, did you do your training? And almost always foster parents will say, I didn't know I had to do any more training. I thought I was licensed. I didn't think I had to do anything else. No, every single year you'll have to do something.
So then we go to, what if I have a past criminal history? Again, as I kind of stated earlier, there is a myriad of crimes that doesn't rise to the level of us being concerned about. Then there are crimes that kind of fall in this middle area where we're like, ooh, we need to look a little further, have more conversation. And then there's certainly a level of crimes where it's like, yeah, no, thanks for trying to be a foster parent, but it's a what we call actually a permanent bar to being a foster parent. So it's not an easy yes or no. And I think you might get sick of hearing that from us because so often it's independent. It's dependent on the situation or and workers involved and the actual crime. So yes, it's possible to become a licensed foster parent. It's actually a little more it's a little easier these days. They made some major legislative changes in the last year and have changed what would prevent people from being a foster parent with the eye of trying to keep families, children with their families. So not a really great answer on that one. So it's kind of a maybe.
If I live with my partner and we are not married, do they need to be on the license? Yes. So if you are living with a partner, both people need to be on the license.
Finally, can we take the children on vacation with us? Normally this is approved from the ongoing social worker. Anything to do with permission for the child to do X, Y, or Z, medication, vacation, those types of things, that is always going to go through the ongoing worker. So start there. And sometimes when you go out of state, again, like Tally said, it could just be to Wisconsin or Iowa. You might need a court order. In some situations, it's enough for the social worker to talk to the parent, and the parent says, oh, well, I don't care, that's fine. And it's documented through the worker. But as you can hear me say repeatedly, the worker, the ongoing placing worker, they have to be involved in getting that permission to go out of state. In other situations, if the parent says absolutely not, I have seen it more times than not, where it will actually, if it's thought to be beneficial to the child, it'll be seen to be taken into court and ask the judge, listen, we want this to happen for this child. The family is going to, I don't know, like the Wisconsin Dells, and they don't want to leave the foster child behind. Can we get the court to order this because the parent is saying no and there's no real significant reason why they shouldn't be able to go? Then I have seen it quite a bit where the judge will approve it. One thing I will add, because it just came up in one of my cases, going out of the country is a no. It's just a hardcore no. I had a grandparent who they were talking about, well, we go to Canada. And I'm like, not this year. I mean, at least not while they're officially a foster child. It's just, you cannot leave the country with the children.
Okay. Now the next thing is, do you have any questions for us, or did we cover everything that you wanted to know about foster care tonight, or are there things that you want to ask us?
Yeah, you covered a lot. The one reoccurring question that pops up in my mind is when I'm still in the process of filling out the paperwork, all those questions. And the one section about, have you parented before, blah, blah, blah. And I have never parented in my life. Mm-hmm. I've been single all my life. And I just I don't know if I can do this. I mean, I'm starting to really, it's like, I'm really starting to really take this serious. And I mean, I know it's serious. But I mean, have you ever worked with people that are single and have never parented before?
Yeah, I just want to jump in quick because you know what? When I was a young mom and I had a baby, I'd never parented before. We all start as never parenting before. Now, granted, this is a little different because I think you said you have a 17-year-old coming into your world. And
yeah.
And here's the thing, we all go through a learning curve, no matter what. We do not look at a person who has not parented before and with any different eye than we do somebody who has had 8 children. I mean, we just don't, because it's not about what have you done and did you meet this box or that box, or none of that is the situation. It's what does this person bring to this child, especially when you're talking about relatives, because it's so specific. And what can this kinship placement do for this particular child? So go ahead, Tally, if you want, because
Oh,
I feel like I
no,
just
you
kind of
gave-
jumped in there.
I was
No,
gonna
you
say,
gave a
I-
perfect
I-
answer.
I've never parented before. I wasn't planning on being a parent. And yet here I am with a newborn. So we're in the same boat.
Okay. Yeah, I'm just, I keep questioning. I'm like, can I really do this? I'm overwhelmed, and yeah, I'm just really going through a gamut of questions,
Right.
And that's actually a good thing, I think.
Yeah.
Because I have had some of the most important conversations with relatives who, and I'm not trying to talk you out of it, but who have come to me and said, this isn't going to work. And I so appreciate that in some ways, because they're not just doing it by their heartstrings. They're
Mhm.
doing it and they know what will work in their world and what won't. And somebody who comes to me and says, we thought we could, but this and this and this, I just look at them and think, you made the best and right decision, because
Mm.
if you know you can't do it for this child,
Yeah.
that, that's a hard thing to say, but
Yeah.
I'm not trying to talk anybody out of it. So
Yeah, I know.
And I don't want you to get discouraged either, like with all the paperwork or everything that's going on, or this is a new thing in your life, because I think it can be overwhelming, and it can be like, oh, what did I sign myself up for? But
Yeah.
because I do want you to know there are supports out there available to try to help you. And I would strongly encourage you to talk with Corey about that and kind of problem solve and work your way through that. I call her,
Okay.
it's Corrine, but I call her Corey, sorry.
Okay. Okay. Thank you.
Very good question, and I appreciate your honesty.
Yeah.
Any other questions or things that we did not cover tonight? Well, I really want to appreciate you guys for being here. I'm going to